Morning. Thank you everyone for joining us for our second COVID-19 briefing. I am here today with Dr. Letitia Jaraza, our Health Commissioner, Colin Tarbert, the President and CEO of the Baltimore Development Corporation, Police Commissioner Michael Harrison. We are also joined today by three business owners in Baltimore City, restaurant owners: Samantha Klassen, owner of Golden West Cafe, Gregory Brown, co-owner of Land of Kush, and Terence Dixon, owner of Terra Cafe. You will hear from them later. Before we go into COVID, I want to first address our other health emergency in Baltimore. Just want to make sure that we understand that we are still dealing with far too much violence in Baltimore City. Since Wednesday, we have seen 5 people in our city lose their life. I myself was on the scene of the second homicide yesterday, and also was on the scene a few days ago where a 16-year-old was shot in Southeast Baltimore. We have to again understand that this is not going to be allowed to continue. We will be targeting and identifying the people that are committing this violence, and they will no longer be allowed to be comfortable on our streets. We also have to, all of us have to continue to not accept this as normal in Baltimore. We also have to understand that we all have a part to play. Yes, it starts with me, the mayor, who have to make sure that the police commissioner, the police department, and every agency is doing what they have to do, but we also all have to do better by ourselves as well. Fundamentally, we have to understand this. We have our young people getting caught in the crossfire. We have our elderly getting caught in the crossfire. And this is something that should be unacceptable to all of us. Again, we will refocus the police department on those committing violent acts in our city and the flow of illegal guns into Baltimore, but we will do that while simultaneously understanding that we have to deal with this issue in its totality, making sure that we are comprehensively addressing gun violence in Baltimore City. We will not, I'll say that again, we will not allow violence to hold our neighborhoods hostage, nor will we accept that the life of any Baltimorean is disposable. I want us to understand that and know that each and every time an act of violence happens in Baltimore, I feel it. I feel it. We all know in Baltimore how it is to lose someone, and we cannot continue to allow that to happen, especially over some of the stupid things that people are losing their lives over. So now let me jump to COVID for overview. Provided overview. As of December the 10th, we have had 31,482 reported cases of COVID-19, 359 people hospitalized between ICU and acute care. In other words, right now, our hospitals in Baltimore are at 88% capacity. 88%. And we are at now 563 deaths. Ensuring our residents have access to testing during this pandemic is critical. It has been great to have expanded availability at the convention center, which has ensured people can make appointments and don't have to wait in long lines. As the winter makes outdoor testing more difficult, today I am excited to announce a new testing center at the Zeta Center, located at 4501 Reisterstown Road in Northwest Baltimore in Park Heights. This will allow our health department to continue community-based testing in our cold weather months. I'm going to turn it over now to our Health Commissioner, Dr. Jaraza, for more information about the expanded testing that they will be doing at the Zeta Center. Thank you. Dr. Jaraza.
Good morning. Thank you, Mayor Scott, for your leadership during this crisis. As Mayor Scott mentioned, we currently have more than 31,000 new cases here in Baltimore City. We're averaging approximately 250 new cases per day. This is an increase of 82% compared to where we were 4 weeks ago. Our latest average positivity is 7.7%, a 68% increase from 4 weeks ago. We are also averaging 4 deaths a day. This is a 250% increase from where we were 4 weeks ago. Today, we are excited to announce the opening of a new COVID-19 community-based testing site at the Zeta Center, again located at 4501 Reisterstown Road. I'd like to thank our hardworking mobile testing teams, many pulled from the Health Department's Office of Acute Communicable Diseases, for their work in securing the site and working to ensure the safety of both residents and staff alike. I'd also like to thank the Zeta Phi Beta sorority Alpha Zeta chapter and the Maryland Department of Health for their assistance and partnership in setting up testing at this site. The Zeta Center, like all of our testing sites, will not require an appointment or doctor referral and is open until 1 p.m. today. Please continue to follow our social media or visit coronavirus.baltimorecity.gov/testing to find the most up-to-date schedule of community testing sites in Baltimore. This evening at 5 p.m., Baltimore City's amended Phase 1 will go into effect. Prior restrictions have been put in place at least 4 weeks to allow us to collect enough data to see if the restrictions are having the impact needed on new cases, hospitalizations, positivity, and deaths before making recommendations on whether to tighten or loosen restrictions accordingly. Many have reached out to us over this last 48 hours and asked questions about how these orders will affect particular industries and settings. We've posted information on our frequently asked questions page at coronavirus.baltimorecity.gov/executive orders. Here you can find more details about specific sections of the executive order. We will continue to update that page as more questions come in. And while we understand these are difficult times, we appreciate your patience as we work to provide up-to-date information quickly. During Wednesday's Phase 1 announcement, I indicated that we've reached widespread community transmission. This has major implications on our contact tracing efforts. Widespread community transmission means our contact tracers are challenged to keep up with the rising number of new cases identified each day. What our contact tracing information does give us is a sense of all the places people have been during the time in which they were exposed to COVID-19, even if we can't always isolate or identify the specific time and location where a person contracted the disease. We also know that 50% of COVID-19 cases are spread by asymptomatic individuals, people who are not showing any symptoms of COVID-19 at all. Again, up to 50% of these cases are by people who don't have any symptoms at all. There are many people right now who are moving around Baltimore City, interacting with their friends and coworkers, feeling fine, but spreading the disease unknowingly. We also know the major drivers of COVID-19 spread are activities that bring groups of people together for prolonged periods of time, specifically in close proximity to one another, during which time they cannot or are not wearing face masks. This is especially true in indoor spaces with poor ventilation. Right now in Baltimore, with very high rates of new cases and hospitalizations across the city, activity in a public setting that necessitates the removal of a face covering represents potential significant risk for disease transmission. Baltimore City is committed to using proven, targeted interventions to lower the number of new cases, to reduce the strain on our healthcare systems, and to save lives. Decisive action has previously been shown to dramatically decrease COVID-19 cases here locally and in other countries across the world. At this point, it is action, not words, that will get us through this pandemic. Eating and drinking with others outside of your household could be life-threatening right now, but we should still aim to support our favorite local restaurants. As Dr. Fauci said, ordering takeout should be considered a neighborly obligation, and one that I hope Baltimore residents who can will join me in taking. Every Baltimore City resident who can should support the restaurant industry and every industry affected by the pandemic during these difficult times. Congress has failed to pass a second stimulus check, and as Mayor Scott said, no one is coming to save us, so once again, Baltimore must lead the way. Help us reduce these numbers in Baltimore. Please continue to wear your mask and practice social distancing. Refrain from spending large periods of time indoors around others not in your household, even with the 25% occupancy limits this executive order places on many locations. Wash your hands frequently, and please stay at home or seek medical attention if you aren't feeling well. This is a difficult time, but we will get through it together. Thank you.
Thank you, Dr. Jaraza. And as a reminder, we are moving in to Phase 1 at 5 p.m. We know the restrictions that are being put in place. Dr. Jaraza has went through them. I will just highlight a few. Again, limits to 10 people or less. I know that many families live in household of 10, that exceeds 10. This does not apply to them, obviously. Outdoor gatherings, as the health commissioner said, is going to be 25 persons, and of course, theaters and entertainment venues will be closed. We know that food service establishments will be closed to indoor and outdoor dining. However, as was just said, carryout will continue, and you can always find the full details of the executive order at coronavirus.baltimorecity.gov. We understand, and I understand, that these restrictions are tough. They are hard. We know that they're very challenging for our restaurateurs and our workers, especially as we approach the holidays. And I want everyone to know that this decision was not made lightly, but was done with an understanding of the science and public health guidance in the dire situation that we will continue to face if we do not take action. Before we hear from members of our restaurant community directly, I want to discuss the support for the city's businesses during this tough time. I'm going to turn it over now to Colin Tarbert, President and CEO of the Baltimore Development Corporation, to discuss those efforts.
Thank you, Mayor Scott, for your leadership during this health and economic crisis. The Baltimore Development Corporation has been working tirelessly since March to assist businesses through this pandemic. At the onset, BDC launched an online survey to assess the needs of our local businesses. We collected over 700 responses. Each respondent was contacted by a BDC team member to gather more information and establish a direct contact. BDC immediately issued and launched the Baltimore Together website, which provided the most current and relevant information for Baltimore City small businesses. BDC became a prime resource for information on the new federal and state programs rolled out in the spring. BDC hosted several webinars with over 1,000 participants to ensure our small businesses took advantage of the programs. In addition, BDC was selected to coordinate a technical assistance network made up of 19 organizations, which included 10 grassroots organizations led by people of color, to ensure we reached our small, minority, and women-owned businesses that are the backbone of our communities. The network has served over 1,300 small businesses and has been successful in ensuring Baltimore small businesses were able to tap federal programs like SBA's EIDL program and the PPP. The network also provided language assistance to ensure our Chinese, Korean, and Hispanic business owners benefited from the stimulus programs. Understanding the immediate need to protect the city's frontline workers, BDC provided grants to local makers and manufacturers to produce PPE. Working with our Made in Baltimore program, BDC allocated $150,000 to a PPE fund that made grants available up to $15,000 to local firms. 17 businesses, ranging from soap makers to canvas tote bags, used the money to convert to PPE production, securing jobs and meeting a major public health need. An additional $400,000 was allocated for procurement of PPE for city essential workers. 9 of the businesses supported were women-owned businesses, more than 50%, and 4 Black-owned and 1 Asian American-owned businesses were supported. Approximately 1/3 of the total funds were allocated to Black-owned businesses. In May, BDC, in partnership with the Neighborhood Design Center and the Johns Hopkins School of Public Health, launched Design for Distancing initiative. D for D, as we call it, brought together 16 neighborhoods to reconfigure public space and to allow for safer patronage of small businesses in our Main Street and commercial areas. Also in May, BDC launched its first round of small business assistance grants, and subsequently a second round in October. To date, BDC has issued approximately $7.5 million in grants to small businesses, totaling 730 grants total. The evaluation criteria established ensured that businesses owned by people of color, women, and city residents were included in the recovery, an essential step to supporting vulnerable businesses that often struggle to obtain financial support. The grant fund also targeted certain Baltimore communities that have suffered from long-term disinvestment. 68% of the grants went to minority businesses, 63% went to women-owned businesses, and 70% went to businesses owned by city residents. At this very moment, BDC is working around the clock to issue a new round of restaurant grants next week to support our local restaurants. We expect to support more than 300 restaurants and the city's public markets with approximately $6.5 million of funding that the city received from the state of Maryland. If you are a business and need assistance, please do not hesitate to contact the Baltimore Development Corporation. We can be reached easily by visiting www.baltimoretogether.com. Thank you, Mr. Mayor.
Thank you, Colin, and thank you for your hard work. I want every single business owner, consumer, and Baltimorean to know that these restrictions are for the health and safety of our community. Period. We are in a life or death situation. These decisions that we make today, no matter how tough they are, will determine whether community members will survive or not. That's what this is about, keeping people alive. This was not a popular decision, but it's the right one. We will continue to assess the impact, but I will continue to be guided by public health guidance and science as we continue through this pandemic. I'm heartened to see surrounding counties. We know that Anne Arundel County went to the same restrictions. Montgomery County has announced that, and also excited to see the state of Pennsylvania put in similar restrictions to what we are doing here in the city of Baltimore. Let me be clear. Any activity that requires you to remove your mask in public right now is dangerous. And we know it's very tough to eat or drink without removing your mask. I haven't seen anyone who can do it yet. You cannot do it. This is not a time to be in public spaces with people outside of your household without masks. It's just not. It's not safe. You can see, talk to, we in Baltimore City, where all of us who live in our city, we know someone who works in those hospitals. Talk to them. Ask them what they're seeing each and every day. Ask them how it feels to have to tell someone that they can't come visit their family member or their loved one who they are literally watching die over Zoom. That's what this is about. This is not about us having the leisure. We all want to. I love to go sit in my favorite restaurants and eat, but I can't do it right now. It's not safe. We have to understand the dire situation that we are in. Governor Hogan said yesterday that the state of Maryland is in red. No, we're on fire when it comes to COVID, and we all have to understand that. At the community level, though, we need to continue to be extremely vigilant to slow the spread of this virus. What does eating out at our favorite restaurant that mean? That means we can do that. We can actually do that. We can continue to do that. But we can't go into that restaurant, because doing that today might mean that you won't be here to go to that favorite restaurant in a few. That's what we're really talking about here. It's incumbent upon all of us to do our part to keep our children, families, grandparents, neighbors safe while wrapping our arms around our small businesses and, most importantly, our restaurant community. I am excited to be joined by some of Baltimore's beloved restaurant owners to talk about their experiences of weathering this pandemic, hopefully also about their good food and firsthand, and how we as a community can best support them as they go through a very tough time. First, I'd like to bring up Samantha Klassen, owner of the Golden West Cafe.
Thank you so much. I'm definitely doing this. Thank you, Mayor Scott, both for asking all of us here today and making a tough call this week. It seems like after nearly 10 months into this, we only have tough decisions left to make. I made a post the other day imploring the people of Baltimore to stay strong and rally together and preserve the people, places, and things that we love. When this is over, we want those places to be here. We want those special places to go back to. We can't get back to work until everyone is safe, so let's get safe. I'm here to share how anyone out there can help save restaurants and small businesses. If you're struggling right now, I'm very sorry. No one deserves this, no one asked for this, and our federal government really needs to come through to support you and small businesses. Some of you are angry and scared. This decision was really hard, but I feel it's the right decision. Some of you are so angry, lots of posts have been made about it. But I just want to say that I know that when I get to that place, I try to channel it into purpose. You can call your representatives in DC. You can demand that they pass COVID relief now. If you are an unemployed industry worker, you can also reach out to the Baltimore Restaurant Relief Fund. They're doing everything they can to answer questions, provide grants, notify people of food relief drops in their neighborhoods. Dave Seal is an angel for running it and helping people like me provide KN95s for our sweet staff. There are also cheap and easy ways to support your favorite businesses. You can share their social media posts across platforms, post your sweetest memories from the last time we were all gathered together, and please tag the restaurants. Know that you're the reason that we do this and that we miss you too. We really want communities to come back to, and we think that without decisions that Mayor Scott has made, those things could be in jeopardy. If you can get carry-out, post photos and tag us so that we know that we're still making guests happy from afar. If you feel like you've had a lackluster experience, please contact the restaurant directly. Negative reviews can impact a business struggling to stay afloat and staffed. Please be kind to business owners and their staff. We are giving it all we've got and generally hanging by a thread. And if you have a stellar experience, by all means tell someone. Tell 10 people, please post about it. If you've got the means to do more, please lean in to this moment. Buy gift cards and use them way later, like the summer, when we're out of the woods. Order food, order booze, buy merch. Some restaurants are offering subscription services, family meals, or weekly deals. If you can order from the restaurant directly, great. A lot of third-party services like Uber and DoorDash can take upwards of 30%. So please do direct whenever you can. Check out their websites and social media for information or the best way to support them. Winter is upon us. Everything that's being done now is nothing new from what's been done to us for the last 10 months. We never opened inside. We felt like it wasn't safe. Now that it's cold, our outdoor seating went down to nothing. Our numbers were right back where they were when we were under total shutdown. This is the best thing for everyone. So please, wear a mask, stay social distanced, stay home, and stay safe. Thank you.
Thank you, Samantha. Next, we'll hear from Gregory Brown, co-owner of the Land of Kush, where they have some of the best vegan mac and cheese in the city.
All right. Thank you, Mayor Scott. Appreciate your support and your efforts. We're just asking people to really support the restaurants by going, go directly to the website, landofkush.com. You can order directly through Google. This saves a lot of the fees from the third parties like DoorDash and Uber Eats. But if it's more convenient for you, we have that set up as well. So please use those third party vendors, go directly to the websites. We also want to reach out to other restaurants that are struggling. If you are struggling with those fees that come along with those third-party vendors, it is much cheaper and less expensive if you have them order directly through your website or directly through Google. If you have an issue with setting that up or you don't know how, please reach out to us directly at info@thelandofkush.com. As Samantha said, buy gift cards. We have e-gift cards. Order takeout. We have those things available. We want everybody to be safe so we can have an enjoyable Baltimore back again. And we want to still communicate through social media, take pictures of the food, support your local restaurants, support your business owners, and understand that it's not just about the business itself, but it's about the employees that we employ. Many of us are employing those people that are difficult to employ. We have a lot of violence that are going on in the city, which I believe you spoke to, Mayor Scott. Well, this is how we try to help keep that down by employing those individuals, giving them life skills, giving them life coaching through the business. So support these businesses that are supporting the community and supporting the people in the community. Again, for us, landofkush.com, you can order takeout directly through the website, or you can go to Google, click on the link, and order directly there. Everybody stay safe, wear your mask, social distancing. We appreciate everybody's support, and remember, we are one Baltimore, we are a team, and we have to work together to get through this particular time. Thank you.
Thank you, Gregory. Next, we will have Terence Dixon, owner of Terra Cafe. I should have ordered a fish sub, Terence. I will have to do that later today. Terence?
Hey, good morning, Baltimore. Chef Terence Dixon, Terra Cafe, also Terra Loft Consulting. Much close enough? Close enough? All right. I want to say first, I don't think anybody has said it yet, thank you to all the small businesses, all those business owners that have not gotten any sleep, have really had to try to figure out how to make this thing work, and consistently changing every day. I want to say thank you, all right, because you didn't have to. I want to say also thank you to all of those that continue to support our small business. And it's real important because it's bigger than just the actual food that you're buying. It's the communities you're stabilizing and this life you change. Responsible for 20 people that I've kept employed during this whole COVID. And not even talking about the other businesses that we've helped in reference to trying to figure out a COVID plan and something that really works. Not just a temporary thing, because this is new for everybody else. One of the things that the restaurant industry has lost right now, that we've lost the touchy-feely. The environment of you coming in, grabbing a meal, knowing your name, knowing where you're gonna sit, we've lost all that right now. But it will come back with the new Baltimore. One of the key things is we need you. All right, and you can support us in so many different ways, just as they shared. We have e-gift cards, and this is just not Terra Cafe. I mean, all your restaurants out there, and the restaurants that hear me that don't have some of these ideas, some of these plans, reach out, Terra Loft Consulting. All right, I got a network that I set up just for us. That way that we're able to actually get the information on the grants and the loans beforehand. All right, we're gonna help you put together your covert folders, which every business should have. That way, when it's time for an opportunity to get some support, instead of it taking a few weeks, it's no more than an hour or two, okay? And we can help with that. But one of the most important things is for us to be safe. You know, at the beginning of this, I think that a lot of people chose profit over people. And look where it got us. We're here now, okay? That was yesterday, to this is today. So the new thing is, we're gonna keep our mask on. We're gonna keep our employees going. We're gonna keep our businesses going. The loaf has gotten smaller, but everybody will still get a slice. Once again, Terence Dixon from Terra Cafe in the heart of Baltimore City, Terra Loft Consulting. Reach out to us. We have support for you. We have some solutions, all right? And I'm excited and thankful that the mayor, Brenda Scott, has allowed me to be on the transition board for small business, for business, community, and workforce. All right, and we already know that most of the problems that happen in Baltimore right now is because it's minimum opportunities for those that never really got a first chance. And small business is that doorway to it. Small business is that key to a safer city. Small business is the key way to New Baltimore. Thank you again. Nobody clap?
Thank you, Terrence. Thank you as always. And I think Terrence, Samantha, and Gregory all pointed out something that I want everyone in Baltimore to do. We know the holidays are approaching. We know that typically we cook for ourselves and have these big meals. What I'm asking everyone to do is order from a restaurant, your favorite restaurant. If it's your favorite place to get crab cakes, order it there. Your favorite place to get whatever you like, support our local businesses by supporting them with your dollars. Support those employees that we're all concerned about, that we know it's going to be tough, it's hard. That's how we can do it. Everybody in Baltimore can do that. We know that we can do that. We love our restaurants. I love the food in places that I go to continuously, because it's not just about the food. The food is great. It's about the people that are working there. It's about what that establishment means to that community, the history, all the conversations that have had about the food in the restaurant, outside of the restaurant. And now we just have to take that into our homes and continue to spread that message. We have to wrap our arms around these businesses and their workers in every way possible right now. And I want them to know that we're going to support them. We love you. We are deeply, Terrence, grateful and thankful to everything that they do for the city of Baltimore, and we will support them every day and come up with creative ways to do that. And at this time, we'll take some questions.
Mayor Scott, thank you. You talk about using data for these decisions. Yesterday, Governor Hogan talked about outdoor dining, according to his health experts, were about 5th on the list as far as high-risk activities. Are there two different data points or health experts you guys are working with right now? And what's your response to him saying that closing outdoor dining was something he would not have done?
So I'll say, as I say again, every single decision that I make is going to be guided by public health advice and science. I would also remind the media and everyone that when we made this announcement on Wednesday, we had the support. You heard from Johns Hopkins that this should happen. I get that advice from Dr. Jaraza, from the folks at Hopkins, from the folks at UMS. We know that Hopkins supports this. We heard it from their mouths directly. This is not something that I made in a vacuum. And I know that members of Hopkins are also advising the governor. So you can take it from there. This is being guided by science. And we also have to understand, I'll let Dr. Jaraza talk about this too, when we're talking about outdoor dining doesn't mean a tent that's closed on all sides with a heater. That's not outdoor dining. That's indoor dining that's just not inside the building anymore. And I'll let Dr. Jaraza go further, but know that the advisors, we heard not just Dr. Jaraza, from the folks at Hopkins who have consistently said to me that this is the right decision to make. And just also be reminded that I'm not the only person that made it. County executive, having that conversation with County Executive Pittman, he did it as well. We know the County Executive Mark in Montgomery County also did the same thing. This is guided by public health advice. Dr. Jaraza, you want to talk about that a little further?
Sure. So what we know is that there is widespread community transmission, meaning anywhere you go, you can be at risk. That risk is compounded if you're not wearing a face mask. You don't wear a face mask to eat, drink, to smoke cigars, to smoke hookah. So therefore, those are higher risk venues, right? So those are higher risk venues. Our interventions are targeted at the venues that are highest risk. And unfortunately, right now, dining with a face mask off, drinking with a face mask off, with individuals outside of your household is a high risk activity.
Quick follow-up. Mayor Scott, you said that some of the health advisors are also advising the governor using the same information. Are you suggesting that the governor's not listening?
No, I'm not suggesting this. What I'm suggesting is my decision was made off advice and the science that they gave me. And as the governor has said multiple times, well, he may disagree and I may disagree with him. He's allowed locals to make their decisions and I made my decision. The governor will make decisions, as he said, as he sees fit. That's it. This is not a political disagreement or argument. This is about me following the advice and the science that was given to me and making my decision. The governor makes his own decisions.
Thank you.
With regards to the testing site that you announced today, I was curious why the Pimlico site, that's also in Northwest Baltimore, closed in the first place. And would you consider another drive-in testing site as the weather gets colder?
Yeah, I'll let Dr. Jaraza speak in 1 second. So she'll talk about why the Pimlico site it was closed and we're moving to this one. But we will be considering other sites. This is something that the Health Commissioner and I have spoken about in recent days, looking for sites that we're able to continue testing, understanding, again, that it's going to be a little harder to do testing outside during the winter months, and everything is going to be on the table. I've instructed all the other city agencies to look at how they can support the health department and looking at testing sites and things like that, and even as we move forward with the vaccine, that as well. All of that is stuff that we are at the top of our priority list, and we'll update you guys on that as we move forward. Dr. Jaraza?
Thank you, Mayor Scott. And I did want to offer one correction. I previously said that there were over 31,000 cases. There's a little over 27,000 new cases, so just that correction. So the Pimlico testing site involved use of tents, and they weren't necessarily, it didn't protect our staff particularly well. As the weather was getting colder, it became more and more challenging for our staff to be out there an entire day in full PPE safely. And so we transitioned away from that tented model to this newer, community community-based testing site that is partially indoors, again, in partnership with the Maryland Department of Health, in partnership with the Zeta Center. As Mayor Scott mentioned, we are looking at potential other locations. The challenges with the drive-through locations is finding someplace in the city where we're not disrupting traffic significantly. So we've been scouring locations for multiple weeks in anticipation of trying to find a drive-through site, but we are a bit challenged to find someplace where, you know, if there's 20 or 30 cars that are waiting, it's not an impediment to traffic.
Do you know if Camden Yards has been considered or as a central location?
Again, we are going to consider all feasible options, every feasible option. This is something that was something I spoke with Dr. Raza my first day. So we'll get back to you guys every option of how we can functionally do this in a safe way, in an accessible way for the citizens of Baltimore. We will consider.
Thank you, Mayor. Earlier in the week, you talked about restoring equity as part of your term. Some folks, restaurateurs, regular folks on the street, they say that they see a juxtaposition that your actions and your words don't necessarily line up, and that this executive order will shut them out and there will be no equity. How do you respond to that?
Well, you think, very simply, everything that we do be guided by equity. But when you're talking about the loss of hundreds of Baltimoreans, right? The majority of them being black and brown in Baltimore, keeping these people...
Do you have the numbers for those?
Keeping these people alive is equity. That's what we're talking about. We are talking about a virus that is attacking our community. And remember, this virus, as I've said multiple times, has exacerbated the pre-existing inequities in Baltimore City that have existed longer than you and I have been breathing. That's the reality. They were never going to be fixed overnight. And we have to understand that this is about saving lives. I think Terence said it best. People over profits. And I'll let Dr. Jaraza give you the exact numbers, but we know in Baltimore, when you look at it, we're talking about the loss of black lives first, and we also know that our Hispanic population also is being hit hardest by this virus.
So just to add on to that, African Americans account for approximately 73% of all deaths, though we only make up about 62% of the population.
Are you talking about here in Baltimore City?
Here in Baltimore City. The Latinx community, close to 15% of cases are in the Latinx community, though they only comprise about 5% of all of the population.
And in terms at 5 o'clock, I don't know if this is for Commissioner Harrison, but what type of enforcement will we see in some of those popular districts? What will your officers be doing, if any, and will something similar be around the casino?
I'm standing behind the speakers. Can you ask that again for me, please? So I can hear.
In terms of the 5 p.m. executive order going into effect, will patrols be out in densely populated areas, restaurant districts? What will your officers be doing in particular? Will we see them on the streets? And also, will they be out and about near the casino for other enforcement, because that is a highly charged topic?
Yes, we will absolutely be patrolling, not just tonight, but every night, with our social club task force made up of police officers and members of other city agencies to enforce the executive orders and to make sure people voluntarily comply. But for those who don't, we absolutely will enforce it and make sure that we're working to keep people safe.
Last question.
Thank you, Mr. Mayor. My question is for Dr. Sarasi. You mentioned that there are 250 cases daily. Could you be more specific and help us understand where they're coming from and what do we need to do in terms of knowing that that's a high number in Baltimore?
Yeah, so there are approximately 250 new cases per day. So I'll talk briefly, but certainly our website, coronavirus.baltimorecity.gov, has the most up-to-date information. You can go to that website and you can look across the city. We have maps indicating cumulative cases. We also have maps indicating in the past 30 days where new cases have shown up. And honestly, because of the widespread community transmission, it really is all over the city. We do have some zip codes that have been particularly hard impacted, 21224, 21215, 21209, but it really is across the entire city.
Thank you. And one question for Mr. Mayor. I've been very concerned in the last, 4 or 5 days of the number of teenagers who have lost their lives in Baltimore's violence. And I just wanted to know, what are you doing as it relates to protecting these young, vulnerable teenagers?
Well, listen, we know, as I said earlier, that any loss of life in Baltimore is unacceptable. But the loss of a young person in Baltimore is even more unacceptable. What we're doing, what I have tasked the police commissioner with, and they know what they have to do, is, again, refocus on the people that are committing the violence, figuring out who these folks are, working with all of our partners to remove them off the streets. We also have to, and this is what we'll begin, you hear me talk about this a lot, as we move forward and think about the complete and comprehensive approach to dealing with gun violence. We'll be identifying, working with our health commissioner, every other agency, who these most vulnerable young people are, trying to put interventions for them and their families. And that's stuff that won't happen, in day 4 of an administration, but that will happen over time, and we'll make sure that you're here to hear what we're doing by building up those kind of programs. Thank you. Sir, last question.
Thank you, Mayor Scott. I know you're pressed on time, so I'll keep it quick. And this goes right off of that question.
Yes, sir.
I know you mentioned, you're early on in your term, 4 days in. Do you have any specific plans in the coming months and weeks ahead to combat this gun violence epidemic?
Yeah, I think you and I have talked about this before. Again, the basic tenements of the plan, and we will be rolling specifics out as we move forward and as the full team is on board. Again, targeting violent repeat offenders in groups, no matter where they are in the city. Targeting those who are gun trafficking weapons into Baltimore, because most of the weapons that Police Commissioner Harrison's folks recover from violent people or anyone else in the city come from outside. But also using the weight of our other agencies to uplift the services needed. We are going to be presenting in the coming months a comprehensive strategy for reducing violence in Baltimore City that will talk about interventions for families, for young people, expanding the work of our violence interrupters, and you guys will be there when we do it.
Thank you.
You.